Welcome back to the Dr. K call. And on this session, we are going to discuss prevention and pre-surgical treatment of painful or arthritic joints. We're going to do a series of these, and today's we're going to deal primarily on the pre-surgical treatment for those of you who are waiting for surgery. So, prevention is obviously an important part of this. And we have these things such as age, genetics, that get to us and catch up with us. There's the environmental factor as to where we worked, what we did all our lives, how we treated our body. And then there's injuries. When we're young, the injuries tend to heal, and we think that we are over them. However, these all seem to come back to haunt us as we age. So, with prevention, the obvious first thing is health. The diet, such as fruits, vegetables, and a balanced diet, are extremely important. Sleep is important. Many of us don't get enough sleep. And we find that we're not as healthy if we don't get enough sleep. Exercise. We all should exercise more than what we probably do. Maintain a good muscle tone and having good cardiopulmonary exercises are going to be very important for how we do in life. Now there's this thing called BMI, which all of you, as you go to your doctor's offices, are finding out about, and it is a ratio or a measurement that's related to your weight and your height, and it gives you your ideal body weight for a particular height, and we need to maintain that in an appropriate range. What we're finding is, especially with joint replacement, if your BMI is over 40, the American Association of Hip and Knee Surgeons actually recommends you don't have an operation if you're over 40 because the risks go right up. And the risks go up exponentially for cardiac issues, for anesthesia, for any number of things that could happen to you. The heavier people have more risks. During surgery, it's harder to do the surgery. There's more of a chance for things to go wrong. There's just so many things that can happen with high BMIs. And you'll find that across the country, more and more people are limiting BMIs because of that. And then there's bone health. We have a bone health clinic, and I think it's important, particularly for women, to go to our bone health clinic. There's a recent study that I read about back pain with people with osteoporosis or osteopenia. Your chances of having back pain or having had an injection of your back or surgery on your back are 40% higher if people have osteoporosis. And women in particular, because you've had children who have obviously cannibalized some of your skeleton, and also because you go through a menopause. During menopause, you lose about 3% of your bone mass each year. You're going through menopause, and most women go through about 6 years of menopause, so you're going to lose about 18% of your bone mass right there. So bone health is important. Vitamin C, vitamin D, the sunshine vitamin, vitamin D in particular for your bone is important. All the other vitamins are also important. A multivitamin would be good. Getting back to vitamin D, the sunshine vitamin. In Indiana, it's hard to get sunshine, but the other places in the country where you are, you might be able to get sunshine. If you get 15 minutes of sunshine a day, that is good for vitamin D. So those are things that we can do for prevention, and those are things that we need to do for a lifetime in order to hopefully prevent some of those genetics, some of that aging, some of that environmental and injury things that lead to having a painful or arthritic joint. So what pre-surgical treatment can we do? Well, exercise, and we talked about this at a previous session. Low impact, low load, multiple repetitions. You can't be the macho man where you're going to do all these heavy weights and all this impact, because your arthritic joint is not going to like that. So you've got to kind of tailor it to what works for you and what you enjoy. It's hard to give you a cookbook, but biking, swimming, elliptical, some walking, some low impact is good. Certainly there's a number of exercise programs out there that can be beneficial for you as well that are low impact. And yoga, things like that can also be quite helpful for your flexibility. Nutraceuticals, these are things that you can take that are not prescription. Glucosamine and chondroitin. We know that the veterinarians have been using this for animals for many, many years. My dog takes it, and she has a bad hip, and she is much better. She's on glucosamine and chondroitin. I take it every morning. And there's all kinds of different brands of glucosamine and chondroitin. Hyaluronic acid, we actually inject this. I'm going to talk about that a little later. But there's an oral version as well that you can take, and that also can be beneficial. Anti-inflammatories, there's natural anti-inflammatories, as we have discussed earlier, such as cherry juice concentrate, the fish oils, turmeric. There's a number of natural anti-inflammatories that you can use. There's the over-the-counter anti-inflammatories, such as naproxen and ibuprofen. The naproxen, the brand name is Aleve, it's usually 220 milligrams. Prescription strength is 500 twice a day. So if you take 220 milligrams, and if you take it with a Tylenol, or if you take one with a Tylenol, and you do that twice a day, that can be quite helpful. Tylenol is acetaminophen. You have to be a little bit careful about how much you take of the acetaminophen. You don't want to get over 2,000 milligrams per day. The ibuprofen, which is like a Advil, the prescription strength is 800 twice a day. So you could take 2 to 4 twice a day and get up to prescription strength or getting close to prescription strength. Again, I recommend that you take it with acetaminophen. If you notice, most of the drugs that are for pain are paired with acetaminophen, and that's because the Tylenol or the acetaminophen helps it work better. So if you pair it with your anti-inflammatory, you can maybe not take as much anti-inflammatory and take a Tylenol with it, and they help each other, and that really helps you in terms of getting you down the road. And then there's all kinds of prescription anti-inflammatories, and again, a telehealth visit with one of our physicians can certainly be helpful, or with your family doctor. Non-steroidal anti-inflammatories, there's many, many different ones. There's once a day, there's some that are more often than that. There's topical ones that you can put on. There's topical over-the-counter, Kaposin, and you can go to any of the local drugstores and find some topical anti-inflammatories that you can get over the counter. Other prescriptions are prednisone. Some of the inflammatory arthritis, such as rheumatoid or lupus or psoriasis, those people sometimes would benefit from a dose of prednisone, but again, you want to make sure that you're getting this from your physician, either your rheumatologist or your family doctor, and that's being followed, because there are certainly side effects for that. Injections. Cortisone injection is your typical thing that we do to kind of kick the can down the road. It doesn't really solve your problem unless your problem's just simply inflammation. If you truly have an arthritic joint, the cortisone will generally help you, and sometimes it'll help you for quite some time. I've seen people go a year between cortisone injections, and they do pretty well. If it helps 2 days, then it's really not worth it. I tell people that you can have it about once every 3 months if it's helpful, but it's going to be diminishing returns until you're ready for surgery. But it does help us kick the can down the road if there's a reason that we have to postpone your surgery or move things down the road. Hyaluronic acid, these are very expensive. Some insurers do not cover these, but it is there's somewhat controversial over how well they work, but hyaluronic acid injections can be very helpful. You can have it about 1 every 6 months at the earliest. I can tell you that I have one patient who is on his 18th year of once a year hyaluronic acid injection. Now that's very rare. Most people don't get that great of a result. So you just want to be cautious, and yet it is expensive, and you want to make sure your insurance covers it. But I've had people get really quite good relief from hyaluronic acid. Uh, the last thing is stem cells and growth factors. At OSMC, we did some of the research with a large orthopedic company on growth factors, and I can tell you that they work in terms of blocking pain pathways. So they actually what we found is worked better than cortisone or hyaluronic acid for blocking some of the pain pathways and decreasing the inflammation in an arthritic joint. But it's still not a solution for your problem. Stem cells are getting a lot of attention. They're very expensive. They don't. They're not covered by insurance, and so I've seen anywhere from $2,000 to $6,000 to pay for these. If you harvest your own stem cells, our stem cells are aged, so they don't work as well as a young stem cell, but they're your own, so you're not getting somebody else's stem cells, so that's good. Your growth factors probably aren't as strong as young growth factors either. And your body doesn't react to this as well. If you're bone on bone, stem cells, growth factors are not going to suddenly make you have a normal joint again. The growth factors may diminish the inflammation for a period of time, but you're still going to need to consider at some point some form of surgery. The growth factors and stem cells may actually work for a younger person or a younger stage in life where you have an injury and to speed up the healing. But once you're bone on bone, it's very difficult to get these things to work. I have one company that I've worked with a little bit where we've taken embryonic stem cells. They've taken embryonic stem cells and grown them in a culture. So the best stem cells are placental or embryonic stem cells, but they're somebody else's stem cells. So there's all kinds of controversy on that and legal issues with that. But the embryonic stem cells, they grow them in a culture, and then they harvest the growth factors from those stem cells. It's almost like milking a cow. You grow the growth factors, and then you grow the stem cells, and then get all the growth factors out of them. And they have like 80 some growth factors that they can harvest out of these stem cells, and then you inject those into an arthritic joint. And in that case, you're not really injecting somebody else's DNA. So those are some of the early things. I think as we learn more about stem cells, growth factors, and research this more, this is a new and exciting look at maybe catching things at an earlier stage before they're bone on bone and making those work. So hopefully that's helpful for you, and we're going to try to do these sessions on a regular basis, and look forward to seeing you next time. Thank you.